The Mayo Clinic Department of Psychiatry and Psychology is a large, diverse group of experts focused in patient care and mental health. There are psychiatrists, psychologists, nurse specialists, physician's assistants who all really focus on the primary mission of Mayo, which is the needs of the patient to come first.
2, 3, 4, 5, 6, 7, and clap.
The chronic pain rehabilitation program at the Mayo Clinic is really based on a multidisciplinary team, run in the adult practice and in the pediatric practice by pain physicians. We bring an array of specialists to the table. We also consider all the physicians, both within the Department of Psychiatry and Psychology as well as across the Mayo Clinic, medical and surgical colleagues as part of our treatment team, so that we're able to bring questions answered quickly and help people to be able to proceed with their rehabilitation.
I want you guys to write down, I am. What are your internal sources of strength?
We're a pain rehabilitation program that's actually housed in the Department of Psychiatry and Psychology, which is a bit rare across the country and the world. And as a result of that, we can, in fact, address comorbid psychiatric difficulties as well as the array of complex medical difficulties our patients have, because we are part of such a large tertiary medical practice. Not only have we developed the pediatric program, but we have become the largest pediatric and adult pain rehabilitation program in the country.
How are you feeling about yourself as a person?
The success has been measured from our research. We've been able to look at clinical outcomes. We find that patients improve their functional abilities, they improve their depression, they are able to improve their psychological distress, they get off their opioids, and those gains are maintained when we follow them longitudinally, both for our adults, and we're now monitoring our children because we have just started to see kids in the pediatric program, but initial results are just as favorable as adults. Whether it's to be able to sit through church or pick up their grandchild or be able to skateboard again, we want our patients to be able to return to the things that they value.
We have a 49-year-old female.
The Mayo Clinic Depression Center is really a great example of how integrated clinical practice can be done to meet the needs of patients who come to Mayo. In this case, in our depression center, patients with treatment-resistant depression and bipolar disorder.
My mood has stabilized a lot. And I tried, self-medicating, drinking, drugging, to try to feel better. That obviously never worked, never will work. We had to find a real problem. The real problem was that I was bipolar. And that's what Dr. Fry found here at the Mayo Clinic. I can have a life, have a family, have everything I wanted to have. Before I literally was stuck in my house, scared to do anything. I had anxiety, panic attacks, and depression so bad that I was paralyzed. Now I'm normal, as normal as you could say someone is.
We recognize that many of our adult patients had first signs and symptoms of their illness as adolescents. We recognize here at Mayo Clinic the pediatric and adolescent portion of our mood program is really critical in identifying these symptoms as early as we can, providing the best recommendations for intervention early in the stage of illness. And we have a pediatric mood program here at Mayo with a great group of psychiatrists and psychologists and allied health staff. The Mayo Clinic Depression Center has a very robust clinical research program. A lot of our research focuses on clinical trials. We have a number of grants that are looking at whether we can utilize brain imaging technologies to help select the right medication for the right patient in the right mood state. Bipolar Disorder Biobank is starting to analyze preliminary data on whether there might be candidate genes associated with developing disease or whether there might be candidate genes associated with having bad reactions to antidepressants. Our hope is that this research will guide the way for the next generation of clinical practice in depression centers, such as what we have here at Mayo Clinic.
The three distinctive features of our program are first that we have a physician-led multidisciplinary team treatment approach with the patient at its core. The second is that we are fortunate to have a very favorable staff-to-patient ratio. We have one counselor for every 4 to 5 patients. Every group has at the maximum 9 patients, and at the core of our program is what we call our process groups that the patients spend 3 hours a day in. Finally, we really do attend to the entire person, not only the addiction, but we attend to the quality of their life and other needs that they have. That could be psychiatric comorbidities such as mood disorders. It could include other medical comorbidities. And we're fortunate to be in a medical center where we can call upon experts that can be available almost immediately to address any of these particular issues, and also to address the spiritual needs of the patient as well. Addiction is tough. By definition, it's a relapsing disorder. To the best of our estimation, looking at our own feedback from patients, looking at our own follow-up and outcome research, it would appear that we are doing better than the national average on patients who are able to achieve abstinence at 1 year. And certainly we have patients, we are willing to see patients in coming back to us to help them reestablish their sobriety if they've had a slip, if they've had a relapse.
My vision for the Department of Psychiatry and Psychology as we move forward is to provide the best individualized treatment for patients with mental health diagnoses. We know this is an integral mix of research, education, and clinical innovation to bring the best individualized care to Mayo patients every day.